I just had two comments, two small comments under the alcohol licensing. The select board, as I recall, what Bob said was the select board was seeking feedback from the coalition, the Board of Health, and the police. And so we kind of left out the police there. And also at the end of that I agreed to summarize the board discussion in a memo to the select board, which I did. And by the way, I don't know if you saw the minutes, they agreed with us around not further extending beer and wine licenses to packaged, convenience stores and gas stations, unless there were, extenuating circumstances. They weren't going to move ahead with that. So that was good.
Good.
Any other comments on the minutes? Look good?
I did. They looked okay to me.
Looked okay to me.
Yep, look good.
Motion to approve the minutes. Carrie?
Motion to approve the minutes.
Second.
Paula, aye. Rick, aye. Approved?
Yes.
All right. So now let's really rock and roll.
Yeah.
COVID. So I'm going to turn it over to Peter and Christine.
Thank you. Actually, I'll just pass it right off to Christine, and if it's okay, Christine's been out straight and would like to get her report done, and we might have plenty of questions, but then she's going to leave the meeting. And go ahead, Christine.
Okay. Would you like me to make a comment about the vaccine clinic first, or just move right into the COVID reporting?
Why don't we start at the top with some case counts, and
Yep.
yeah, then we'll move down to handle the vaccine. That'll probably
Okay,
take a little while.
Sure. This is per Maven reporting, and data is subject to change. It does not include today's numbers or closed cases over the past 48 hours. Last year, total number of COVID cases is 1,123. Current month, year to date, is 307. Total deaths, 43. That would be 41 in the year 2020 and 2 in the year 2021. There have been 10 transferred cases. According to testing, the total number of tests that were performed on Reading residents over the past 14 days have been 4,344. The total positive tests in the past 14 days have been 276. Schools, Reading Public School, and these figures have been worked on in collaboration with the school nurse. High school, 6 active cases, total from start to present time, 69. Active middle school cases, 3, total 43. Active elementary, 5, total 35. Staff, 2, total 34. And right now in school season sports, there are 3 positive active athletes and 9 members of the team are quarantined. Austin Prep has 9 active cases. 3 are affiliated with in-season sports. Clusters. Bear Mountain has 6 active cases. The director of nursing has notified me that they are performing testing twice weekly. Artist Senior Living had 6, most of them have, 10. 6 have been closed. only 4 active. And testing is also done twice weekly. Miscellaneous, and I'm sorry, there's one more cluster at Smart Physical Therapy, and there's 2 active cases there. Miscellaneous, Home Depot has 1 reported running case. And that's it for numbers.
So
That's it for
Christine,
clusters. Sorry. Yes.
going to the top of your list, what would, excluding cases that came in today and the ones that were closed in the last 2 days, what was that number that you mentioned?
So I was giving the numbers for like the year ended, and then January 1st, I was given the count. So last year, there was 1,123 plus you add the 307 from this year. So a total would be 1,430 total overall.
Right.
So I guess I broke it down, you know, from 2020 and then 2021, but I
Right.
can report it differently if preferred.
But if we took a snapshot of today active cases that, you know, with plus or minus 10, because I know these numbers are move around, but what would you say today the number of active cases in the town are?
The number of active cases?
Yeah, not year to date, but you know, today, how many, let's say, are you contact tracing?
So I would say a little over 300. Now, I know that a larger number has been reported, but I truly believe that that is because they've not been closed out timely.
Oh. So, you know, is there a way to work that? Because
Yes.
it looked like the numbers that I think Laura sent out a day or two ago was 600 and some, looked like another 100 over the previous week, which is startling, you know, and I figured it was some kind of, you know, mathematical time frame, close, open, you know, something going on. But you know, my concern is like when those numbers go out to the public, it can be, you know,
Yes.
cause
Yes.
people be upset or, you know.
Yep. Cases should be closed. I mean, if you think about it, quarantine, 10 days, they exit on the 11th. Isolation. And then if they're doing the 14-day quarantine, cases should be closed timely. I do know that, you know, there's been an increase over the past, you know, 3 weeks, and cases have not been closed in a timely manner. And yes, I will work on that with the nurses to report that to Laura.
Okay. So who closes it? Do we close it, or does someone else?
It's in collaboration with the state, but we actually close it and report that number to Laura.
Okay.
So each nurse that starts a case works it from beginning to end. And I think that could be where the larger number is lying.
Yeah. Well, that would be something to work on, just because it portrays, you know, a different picture.
I can also start auditing every 2 weeks and make sure that if cases aren't closed out, that I alert the Maven users and the nurses to, you know, to close them out if not.
Yeah.
If they haven't been.
Okay. Carrie, did you have a question? No.
I was wondering, so I think that what you described, Christine, about tightening up the audit and so forth, I think that sounds great. It's more challenging to close out cases when case volume goes up. Is that true?
Yes.
Okay.
Yes.
And then do you think there's any impact because folks were drawn to some staff were drawn off to be doing vaccination and so not able to be doing contact tracing work?
I do.
Okay. That's helpful to understand kind of what the,
Mhm.
what, yeah, what the sort of, what the inputs are that might cause that. Yeah. Okay. Thank you.
I think we were prioritizing on the active cases coming in every day and making sure they were contacted. So
Yes.
Should be.
if, for
Yes.
example, 25 cases were due to be closed that day, they were not getting closed until a day or two later, or even beyond that. But I agree,
Yep.
it has to be tightened up, and
But
I will
that's,
start
I,
auditing.
no, but that sounds, I mean, that's the right priority. I agree that you want to make sure that the contact tracing is occurring. If, and, you know, if you have to choose closing out versus
Mhm.
contact tracing, certainly contact tracing takes priority. I understand I understand the choice, if it's a choice, I guess.
And Christine, this is Paula, just asking,
Hello.
are you seeing any decrease coming over the last few days in the numbers of cases per day?
Yes, we are. And we are definitely seeing a decrease in the school system right now as well.
Great,
Good.
good news.
Good news. Good
Mhm.
news for everybody.
Yep,
Hope it stays that way.
Yes.
yeah.
I just have one
I,
quick question, if I could.
Oh,
Sure.
sure.
Hi, Christine, it's Kevin. I asked you this
Hello.
a while back, and I'm just curious to see if there's been any mention that you're getting from the state on the cycle thresholds, the CT values for the testing. Are you hearing anything about those as of yet?
You mean the number of testing? I know that weekly I'm being forwarded, like the timetable of testing and how many is being performed.
No,
Do you
this is
mean
more
in
of a
addition
value.
to that?
This is more of a value that they're trying to they're trying to make a little bit or an exact. They're trying to make it an exact science, so to speak. So it's a
Okay.
the first cycle threshold is a value that is given off for the testing machine, how to in a sense how much viral load is detected in the person, and when the threshold gets too high, they're saying that viral load that it's detecting is probably dead viral load, and that they shouldn't be
Oh, I see
at
what
high
you mean.
levels. So it's more of a
Mhm.
kind of, with with all the talk that's going on now with
Yeah.
I know a lot of cities and towns are talking about pooling testing at schools.
Mhm.
And I know we've had a brief discussion about that. I was just curious if the state has been giving any of those numbers out as of yet on those CT values.
Not that I'm aware of. And Mary Juliana from the high school did mention that about the pooling, and stated that she would like to, be involved with that. I will definitely send an email and follow up with a phone call to one of the epidemiologists with the state and inquire, so I can get back to you with regards to that. I have not received anything
Okay.
personally, but I will definitely look into that.
Yeah. Again, the last time I brought this up, I know there was someone over at Harvard was trying to, make it that it's an easy thing to peg every time, that it's consistent. But they hadn't at that time. I wasn't sure if if you're not hearing it, that probably means they haven't as of yet either as well.
Okay.
Thank you.
I will definitely look into it though. Thank you.
I'm not a student of the CT testing, but from what I'm seeing about it is, it's helpful in hospitals for comorbidities. And I'm not sure if they've really designed a plan or a program for it to work in the general population. And so we might be a little bit ahead of the curve on this. It's okay with me if we are, but I don't want Christine to feel like she's behind the learning curve, or needs to jump all over this thing. She really doesn't at this point. We'd like to keep reading about it and stuff.
It's more just for could be useful information for prioritizing as cases come in.
It's what?
It could provide useful information for prioritizing cases as they come in. So if all of a sudden you have 10 cases dumped on your desk, and we can see that the CT value on 8 of those is over 35, 37, on that scale, and you have some that are down in the teens and 20s. Those teens and 20s,
Mm.
you know, are highly contagious people. That's what this
Yeah.
testing is suggesting. So it could
Mm.
help prioritize who you start with in that batch of 10 that you just had.
Oh, I see what, yes, I see what you mean. Mhm.
And I hope it's not controversial or in any way deemed that I'm, just being argumentative. This is useful information once they're hospitalized. And I mean, moments ago, we're talking about closing cases so we can get a better handle on, the accurate figures in the community. And, this is another whole, element of it. And I don't mind keeping the discussion going either, but trying to keep it in perspective for Christine and Mary.
Peter, I definitely don't want to drive the discussion to somebody go out there and run this down and figure this out. It was just
No.
more of a curiosity to see if the state is pushing this down to us.
Okay.
I don't think we need to go run anything down with this. If they get it straight, they'll definitely probably let us know about it. And I don't think we have to bother with it until they get it straight. So.
Yeah. But I
I'm
know
glad you're there,
from-
Kevin. Excuse me just one more second. I'm glad you're there, Kevin, and bringing this stuff up. It keeps our minds sharp.
Yeah, I'll just add in, I mean, from participating in the twice weekly local public health calls and conversations with the state epidemiologists, they're very cautious about bringing in new markers until they're sure, I mean, you think about the antigen testing, that's not they've been very cautious about it. And I think Binax is the only one that they're comfortable with the results of it and comfortable with using it. So,
Mhm.
so it may be that Kevin, you're on the cutting edge, and
As usual.
and right, and the state, will be cautious and catch up.
Sure. Yep.
Yeah.
I just sent off a link that takes us to another level. We can bring it up,
Awesome.
whenever you want.
That's great.
So Christine, you want to talk about the
Mhm.
vaccination clinics?
Oh, I would just like to say, first responders, we've had 3 clinics on a smaller level. 96 vaccines were administered to first responders, and we have 20 remaining vaccine available, and we're planning, I know, another future smaller clinic. I also know that 80 were ordered and pending delivery. I feel that these smaller clinics went extremely well, and I appreciate, being involved in it and a part of it. I thought that they went very well.
Terrific.
That's great to hear.
It was good. Peter, do you want to?
Yeah, there's a lot of moving pieces to this. I don't mind covering some more of them. And ProgMod is I think it's probably the hub of where we are with our future of vaccinating. And tonight, we saw a presentation. I wasn't sure what to expect. Schwang said she would like to present tonight, and I kind of, oh boy, what is this going to be about? But she demonstrated at our staff meeting a few hours ago, and it's really very fascinating the way she pulled this together in just a short period of time. So if it's okay with you, Mr. Chairman, I would like to turn this over to Schwang. I'm pretty sure she's ready to go.
Sure, great. Schwang.
All right, thank you, Peter. And hi, everyone. Good evening.
Hi.
Good evening.
Hi. This week and last week, I attended our COVID vaccine event in Reading, and not only as a vaccine provider and event organizer, but also as an vaccine recipient. And I think our vaccine events are safe and well organized. And I greatly appreciate everyone's hard work to make these events a success. And like Christine said, until now, we vaccinated nearly about 100 first responders. And we are looking forward for our future events. So ProgMod, everybody is talking about ProgMod these days. So basically, ProgMod is an informatics system for vaccine clinic management. And based on my understanding, I draw flow chart. It's here. Let me just share my screen. I draw a flow chart to give you a brief picture about how ProgMod design and how ProgMod works. So can you see my screen with
Yes.
the?
Yep.
Okay, great. So first of all, we assume that we have already received the vaccine, and then we can use ProgMod for vaccine inventory management. For example, put in the brand name, lot number, expiration date, etc. And after that, we can create a vaccine clinic. The system will automatically generate the vaccine information and access link. And the participants can use cell phone, iPad, and computer to make appointment online before the event. And on the event date, we use ProgMod for documentation and clinic management. For example, nursing can document which arm they give the vaccine and how many doses we have already administered. And so for Tuesday's event, I created this this link. This is the information generated by ProgMod. So basically, it includes the location, the address, the access link that participants can use this thing to registration and making online appointments. And this is a private clinic, which means it's not open to the public. It's just for first responders. Clinical date, start time, end time, duration, age group, and I select 7 minutes as the appointment frequency to maintain the social distance. And we have 2 nursing stations. Town of Reading hosts the event. So, and now I just want to show you a quick demo about how participants can use this access link generated by ProgMod to make their vaccine appointment. So after you click the link, and you will see, let me see, hold on 1 second. You will see something like this. So it is ProgMod sign up for vaccination on January 19th. Can everyone see the screen?
Yes.
Okay, great. So this form, this process is very similar to the paper-based insurance and consent form we are currently using. And it includes personal information, health insurance, health screening questions, etc. And ProgMod have 4 different language versions: English, Spanish, Chinese, and Portuguese. So when participants on this page, they can start enter their name, race, ethnicity, date of birth, gender, email address for second dose reminder, phone number, and address. And then they can save and continue. Oh, it want me to do it again. Okay, so I just quickly put in the data. And it sorry, I just put our townhouse address. Okay, and then the
Very
next
fast.
page. Thank you. And the next page is the insurance information. So the participants need enter the type of insurance. Most people may have the private insurance, and they can put the insurance name, member ID number, the policyholder's name, and the relationship with the participant. And please be careful that if participants do not provide their health insurance information, our town of Reading will be unable to bill. So that's why they required this health insurance information.
Can I ask
So-
a question about that? Why are we
Sure.
billing if it's being provided free?
Yeah, so the vaccine is free like this screen said, but the insurance will charge for the administration of the vaccine. And I have contact with ProgMod person and confirm that if we don't fill these information, ProgMod can, our town of Reading cannot bill for this. So far, so good.
But does it exclude people that don't have insurance?
If they don't have insurance, you mean they are uninsured, then they can choose no insurance.
And that's okay with us, right?
Yes, there may be other funding sources later on in the process that would reimburse the town for, the event, for the uninsured. And, the magic number for this is $45 per shot, and it can be significant. So this is paying for the administrative fees, Jerry, and those become substantial. Anybody, when you start thinking about it, there's a lot of people involved. Admins, the nurses, and the equipment that we need. So, I mean, it kind of is elusive. I've gotten a lot of questions on why the insurance, and so if we can go back and get into this a little bit when Schwank's done, but let's let her keep her rhythm.
Okay, thank you. And then it's the health screening question. So participants can fill these questions, and the nurses will rescreen all of the questions before they get the vaccine. Okay.
And is that because this is ideally filled out several days ahead of time?
Yes, that's why we need to rescreen at the nursing
Yes.
station. Yeah. All right, then they
Ask a
can.
quick- Sorry to just interrupt, Frank, real quick. In regards to
Sure.
that, the questions,
Oh,
is there
sure.
an issue or with folks that have had COVID-19 getting the vaccination? I know there's a lot of questions on there.
Yeah, there are like they ask if you feel today, if you feel sick today, if you have any allergic reaction to any vaccine, if you receive any vaccine in the past 14 days.
No, my question's
Yeah.
more around the positive one. Have you
The
had a positive
positive-
test for COVID-19? Does that affect someone's ability to get vaccinated if they have been
No,
positive?
no.
Okay,
If you have COVID, no.
okay.
There
Okay.
was some, just for a moment, there was some
Sure.
concern about that deep in the literature. There was some recommendations, but that has been proven so minuscule. We're not in.
Great. Okay.
If Christine is still here, she can address that better than I am stumbling around here.
Yes, and one of the questions actually in ProgMod and on the paper version, the questionnaires that the nurses ask, it does ask if you have had COVID within the past 14 days. I know that that's one of the questions. It doesn't prohibit you from receiving vaccine.
Thank you.
Okay. That's
Can I
great.
just ask one question? At the top, it had both Moderna and Pfizer. Do any of these, and none of these questions lead to one or the other, right? We're just given what we're given.
Yes. We're given us a supply of vaccine, and yes, the answer to that question is yes. We choose which one to point to because of and I wonder if that could be pre-filled in now that I'm trying to process why that would be a question.
I think that might be a question because you're not supposed to use, you're not supposed to get one vaccine and then on your
Okay.
21 or 28 days get another vaccine. You're supposed to get the same
Correct.
for
Yep.
both.
Yes.
And so that's why they're asking, I think, that so that
Yeah.
so that if we're going to give Moderna and the person answers yes, I got Pfizer 3 weeks ago, then
Yep.
there has to be a conversation.
Yeah, and it
I
just looks
think
like there's like an option to
they-
choose. I mean, that's what it looked like to me,
Howard.
but that's not true.
Is it?
Yeah.
I'm not certain about that. I don't mind drilling down here for a moment, Jerry. So, Swang, is there an option? Because people signing up might not know which vaccine is going to be available when they show. So my question earlier was, can this be checked off?
Yeah,
The type of vaccine.
the vaccine recipients, they all get a card that have the brand name and lot number, so they can refer to that card and they will know which vaccine they get for the first dose. And like on the consent form, it says if it is your second dose, you must get the same vaccine brand
Right.
to be considered full vaccinated.
So in Reading, we only have Moderna, and we're gonna
Yeah.
only have Moderna for a
Yeah.
while. Okay.
Correct. Okay, so far so good. Do you have any other questions so far? Okay, so yes, Reading is giving Moderna vaccine, and the participants can either sign or type their name. And save and, oh, I should put the relationship. Okay.
Sorry.
So now the participant can review their information. They just put in and continue. Okay. So now they can select a time for their appointment. And like I mentioned before, I set up 7 minutes for the appointment frequency. So you can see every 7 minutes, people can have a specific time slot, and 2 nurses will give vaccine on a specific time to maintain the social distance and increase the efficiency of the clinic. And if the appointment is full, participants can add themselves to waiting list, and we will contact them about their appointment. And so in conclusion, most of the information required for ProgMod is exactly the same as the paper-based insurance and the consent form we are currently using. So one of the ultimate goals for ProgMod is to get rid of all the paperwork. Okay, that's it. Do you have any questions?
Do you mind if I elaborate just for a moment? Oh, excuse me, doctor. But we would do, before ProgMod came online, yesterday or today, we were setting up our clinics in reverse. The fire department was contacting the firefighter on what day to show up for, or what time of the day to show up for their appointments. And this works. We have, if you followed it, and I hope I'm not speaking down to anybody, but if you follow the process, you start with a stock, and then you have a number of nurses stations, and then you know how many, and then you have a time for each shot to be administered, and then you know how many you can fill in per hour and how long our clinic is going to be based on how many hours in the day, whatever. And then that's what's driving the appointments. Before it was, let's tell these people to come down, and hopefully when they get here, there'll still be enough vaccine, and one of the nurses won't have to, so forth. Anyway, I think this is really the epitome of it all, when you see the appointments being made and the paperwork being completed, including the all-important piece about the insurance. Okay, that's all. I didn't mean to summarize Shang's great presentation here.
That was a great presentation and very helpful from the consumer point of view. I just want to be, well, I don't ask a question or maybe confirm my understanding is that ProgMod is used by us to order vaccine on the front end, and on the back end, after the vaccine is given, I understand that information goes to the Massachusetts Immunization Information System and to the program. So ProgMod is actually feeding information back to the state, as well as we're using it to get the vaccine. Is that correct?
ProgMod is only for vaccine clinic management and send the records to the state, but ProgMod cannot order vaccine.
Oh, okay.
Can I fill in a blank for that? Because I don't want to be remembered as giving bad information. We cannot get vaccine until the ProgMod, until we've signed up for ProgMod, been approved for it, and are working on training on it.
I see.
Only then are we eligible to get the vaccine.
Hmm.
And now how it gets back to MIIS is a good question. I'm not sure if I know the answer to that right now.
Okay. Okay, just wondering.
So,
It might pop into
from
my
my
head.
understanding, from
Yes,
my
thanks.
understanding, it is linked to MIIS. So it will forward the data that we would normally have to either input ourselves and then submit to MIIS, or but there is a way that we can easily submit it to them from using ProgMod.
Okay,
So
thank you.
it does save on having to re-input that data and send to them.
Yes.
And
That's-
from what
that's
I've been
correct.
told, excuse me just a second, from what is flowing down, they will also use that data against us if we're wasting vaccine, or if we're in
Right.
any way violating the phases going along the way, we could get shut off from receiving more vaccine.
Correct.
Dwayne, do you have access to what documentation looks like in here, or not yet?
And at this time point, I don't have the documentation because we currently have no patients in there, so I couldn't put any documentation through anyone.
That concern is legit, Jerry, if you want to keep going.
Yeah, no, I just wanted to see what information is being transmitted.
Oh,
You know, like a lot, I imagine a bunch of information. I'm just wondering what type of data is needed on their end to be able to sync them.
information is similar to the consent form that we are filled
Just
out.
name and address?
Yes, and like we have nursing documentation on that form. So it's, like I said, it's very similar to the paper-based. It's just now on the system.
But we anticipated a discussion going down this route, and I'll address this to Jerry, and I thought this is where you were going to take us, so I wouldn't have to. But ultimately, there is going to be some sensitive information on this form that's going to be, shared with the people who are using ProgMod. And the most critical piece, and I thank Christine for bringing this to my attention. It didn't even occur to me really. Probably would have late rather than never, but are the insurance cards.
Yeah.
So here's a guy, here's his insurance number and his insurance company. It's like, ooh.
I will tell you that might be a barrier to some people wanting to put in that information.
Well, the conversation may continue, and I wanted to clear this with our nurses and with Jean before, it was brought up, but we want to limit the number of people who are having access to ProgMod so that we can maintain public trust. And I don't mind this discussion going back to the board. We don't need any votes or anything like that, but if we carry on for just a few moments on the importance of what Jerry is bringing up here, we might be able to, because there's a lot of people that want to get trained in ProgMod now, so they can be part of the process. And with all the best intentions, they are. We have firefighters that want to learn the stuff so they can be banging away at it. And it's hard to say, no way, you can't, we don't need this many people. Well, you might need, so.
Yes.
Well,
No,
I think, this, this sort of gets to some of the conversation or emails we've had in the last couple of days around the planning for the clinics, particularly for phase 2. Because if you look at the phase 2 potential recipients, it's huge. I mean, it's absolutely huge. Everybody over 65, plus convenience store clerks and transit people. And I mean, the list goes on and on and on. It could be thousands. And so maybe someone, I understand Incident Command has started some work on this, but can talk about how we're viewing the clinics to be set up for phase 2, because that is going to be big scale. And that sort of gets back to the question of how many people should have access at ProgMod, right? Because you have to know what your operation is, and then you want to know, okay, we're going to need 6 vaccinators or 10 and that's all we're going to train on ProgMod. But until we have a big picture of how the mass vaccination process is going to go, it's hard to answer that question. So I don't know, where is Incident Command, or where is the planning around phase 2?
Peter, do you want me to?
Well, let me just start off, and then you can take it, Kerry, because you were on the planning committee, and you can take us where you were yesterday. But I want to remind everybody, especially now that we've seen ProgMod in action, that the supply of vaccine is what's driving the people who are going to be receiving it, not the number of people who want to receive it or need to receive it. It's the supply. And that's a hard one to swallow. And until we have that supply, we can't even start ProgMod. So that really drives. Now, if they tell us you have 10,000 doses and they deliver it to Reading, we're going to need a different plan than the one we've been working on for a long time. But that might keep it in perspective. And now I'll turn it over to Kerry.
Thanks, Peter. That's a good and important starting point. So I mean, in planning, so Incident Command asked planning to take on the discussion of what a next phase clinic would look like. And what we're talking about is definitely scaling up, but it would still be more like a pilot because we're trying to ascertain what are the available resources, what kind of staff are available. We certainly have school nurses and access to different folks. The challenge is all those people have regular jobs, and this isn't a flu clinic. This is not something that we get together and do one day and everybody's happy, and it's not the simple thing that flu clinics are. It's a novel vaccine. It's a highly contagious virus. There are more precautions and things that need to be taken with it. So the answer is we haven't even gotten to the place of talking about ProgMod yet. We're ascertaining what would the resources be that we can have access to do a portion of those people that are in phase 2, so that we can learn from that. So we're going from first responder small, next level up, do a little bit more bigger, learn from that, and see what is possible. So ProgMod is on the list. We've discussed it, but we're still at the place of planning sites and talking about layout and talking about staffing needs and planning a prep setup, that kind of thing, if that helps.
Okay,
Peter,
can I?
see you.
Yeah,
Yes.
yeah. This is tag team
Yep.
effect. I want to cover as much as we can without being, boring about it. But let's go back to the emergency dispensing site, EDS. We have been planning, and I say we. I have only been in Reading for a few months, but the state has had local health planning their EDS, and I'm thinking it was before 20. It happened right after 9/11.
Yeah, 2004 was the first time I did pilot emergency dispensing site plans. It took us a little while to get going, but 2004, I've been working on it since then.
Knowing full well that we don't know what we're preparing for.
Right.
We don't have a vaccine. We don't even know what the disease is yet, but just find a spot.
Yep.
And I've said this before. I know you've all heard of it. show us where the loading dock is and where the refrigeration is going to be. And we have to do everybody in our community within 72 hours. That was the mandate that we received, and we drilled on it at least twice a year.
Yep.
And we had to revise our plans.
Yep.
Once a year. And we just finished that when I got here,
Yep.
the plan revision piece. So to Rick's
Thank you.
questions here,
Right.
this is not something slamming us.
No.
It's been slowly, in a whole psyche for a long time.
This is a long-standing, this is, like I said, I've been working on this since 2004. There are lots of people who are paid money to do regional planning and help develop those layouts and then work with locals to fine tune them to the specifics of the community. So we know you're going to use the field house or you're going to use Coolidge, all that's all known knowns. So what the planning group is talking about is, so, okay, what are the fine tunings that we do now that we know a little bit more about the social distance needs, about the time that it'll take to vaccinate people and the like. Yeah, no, this is not, thank you, Peter. I just figure everybody remembers that. They don't. This is
Christine, do you
not-
want to say something? You're
Thank
done?
you.
Okay.
Well, this is very different from flu clinics. This is
Totally.
obviously, and just even at a higher level, because my concern is that phase 2 comes along, and if you thought you've been getting a lot of phone calls now, you'll be getting a lot of phone calls. There's going to be, there's going to be a surge of interest in this. And it appears that there's basically 3 places you can get the vaccine. One is at these mass vaccination centers like Gillette and Fenway, and maybe the state will set up others. And I hear that the federal government might even set up mass vaccination centers. So that's kind of one place. Another place is your doctor, your own doctor. And I was at a Mass Medical Society meeting night before last, and there was a lot of angst on the part of private physicians about getting access to the vaccine. I think hospital systems and employed physicians are getting better access, I think, than small offices, but that's another issue. And then I think it's, the town, the Board of Health, the health system. So seems like there's 3 places people can get it.
In pharmacies.
Pharmacies.
Oh, and pharmacies, that's right, that's right. So at a higher level, like, what should we be targeting in terms of volume that's going to drive your planning? Because, if you thought, gee, we have 24,000 people in Reading, and we think phase 2 might be, 10,000 people, and how many of those 10,000 or 8,000 or whatever it is, how many do we feel responsible to set up to vaccinate? Because we think others will go to the pharmacy, their doctor, or mass vaccination. I don't really have an answer to that. I'm just,
No, I do.
but it drives how big a operation you want to do.
No, it works the other way,
Peter, you
Doctor.
first, yeah, go.
Because
you first.
it depends on the vaccine, the stock of vaccine. They might only be giving us 200 vaccines, and then we can only vaccinate 200 people.
Right.
Then it's not going to be a free flow of vaccine, and I think that's probably the,
I see.
I don't know, the devil in the details, whatever you want to call it. But
Right.
it's all going to be controlled by how much vaccine you have in stock. And we're not going to just have an unlimited supply continuously.
Do we know at the higher level where the vaccine is coming from and how much is going to EDS versus how much is going to hospitals and CVS?
I don't know that.
Terry
answer.
does.
No.
If I may,
Yeah, sure, okay.
can I? So, right now, the only places that have vaccine, I think that Foxborough place is set up, hospital systems have it, and health departments or other folks that have gotten together to do first responders. Those are the only places that are getting it. That vaccine is getting shipped out from the state based on approximations from the people who are vaccinating of how many people they are able to vaccinate, right? So there's a tension of, we have this many doses. They want to hear from people of, what do you think your capacity is? And then they kind of short that a little bit because they don't want to oversupply, because we don't want vaccine sitting in the shelves. Vaccine has to get used up within 10 days.
Well, that's what I was wondering, if they're saving
Thought it
the,
was 30. No,
Once it's opened.
once it's open, 30. Defrosted, 30.
no, that's what I, but the next few that are coming, like, are they gonna target those more towards?
If I
Okay.
may,
Yeah.
the state is requiring that vaccine be used within 10 days. It is correct that it is good for 30 days, but they have said that you must use the supply you are given within 10 days. If you don't use your vaccine, that affects the ability to get new vaccine. If you're not using your vaccine efficiently, they will give you less. So that's a key. That does not have to do with vaccine manage with quality control, cold chain, or your storage. That has to do with state requirements, because they're trying to make sure that it's flowing out to the variety of places, that it's not they don't want people to stockpile. So, and then, I mean, it may go out. It's out at pharmacy vendors right now so that they can vaccinate long-term care facilities. It's not in pharmacies yet. There is some discussion of pharmacies maybe being able to do that. I'm sorry, have you seen vaccination happening at a pharmacy?
Well, there was something in the newspaper about, they listed like, I don't know, 10 or 15 CVS and Walgreens pharmacies where they were going to dispense, I don't know, 10,000 doses or something like that across the state. But it would be for phase 1. Is that your understanding, Jerry? Did you see that?
I think I saw that.
Yeah,
Fascinating.
we saw
It's
that.
just for phase 1.
Yeah,
Good to know.
yeah.
Fascinating.
So it sounds like, from what you say, Carrie, that if we set up an operation that could potentially vaccinate 1,000 people a week, then, and we say we have that capacity, then we will get that amount. But if we set up an operation that on paper could submit 200 per week, then that's all we'll get. So in some ways,
Yeah, sort of, but those are only like theoretical numbers. Yeah, I mean, they're playing with having the vaccine come from a number of different places, and I know physician practices are the big priority for phase 2, for those over 65 and so forth, because they can schedule a little more easily.
Let me pop some reality back into this, if I may. I'm saying if I may, it sounded like Kerry over here. Or who was it that was
That's
saying
me.
if I may?
That's me. Well,
When we finished up our first responders, we had to notify folks. We asked for 120 in the first place. We counted the first responders, so we had a number for that, Rick, and we got 120. It turned out we only needed 96, which left us roughly 22 vials left now. And then I was asked, how many more doses do you need to finish off phase 1? And this is good. It's going to get the conversation moving to the next piece of the vaccine. And I had no clue on what we would. So I'm asking within our region, well, how many did North Reading ask for? How many did Andover ask for? And I ended up choosing, basically, I don't even know what I used for rationale. I said, we'll take 80. I don't want to ask for too much. I like to be conservative. We don't want to waste it. So we have 80 doses on order that will come, that we can then get at the rest of our first phase 1 people out there. And this is going to become an issue next. How do we identify, how do we get the word out that we have vaccine for phase 1? And we do have a short list. An interpreter called in, a midwife called in. We have some dental folks that are calling in and stuff. But yeah, right now it's kind of It's not a pure science.
No, not at all.
So can I ask a couple questions?
Of course.
Trying to wrap my head around this whole thing. I guess I put too much faith in the state yet again. I thought that this ProgMod was going to be the driver for all of this data. If I go in and I sign up and I select my site, there's one vial.
Yes,
It isn't
One
Yes.
dose.
right.
yes.
So that theoretically, we've got the person signed up, and we've got the vial now ordered. Now they know to send us at least one.
Yep.
That's how it will work.
Well, it
Yep.
sounds
That's
like,
not how it's gonna work.
Yeah.
Okay, because that's what
Well,
it
well,
sounded a little different than what I'm hearing here.
Yeah, I know. It's an estimate in the first place, and then we can plug in design clinics as Schwang has shown us tonight. But it all begins with, the availability of the vaccine, how much trust they put into the communities that are saying, well, they wanted 200 doses and they only used 20. It's like, who's making the decisions over there?
Right. That's what bothers me. It's the fact that it sounds like we're guesstimating and then having people sign up. Why isn't it the other way around? And why can't it be?
Well-
Why can't people
Well,
sign
I have a
up
quick
and
answer for
therefore
that, but I don't
triggers
mind
the
sharing the
number of
idea.
the numbers you get? How many people sign up for your particular clinic? That triggers the number that are going to be delivered to you.
Because there's not an unlimited amount of vaccine.
That's
Again,
pretty
it
much
goes back to Peter's point. There's not an unlimited amount of vaccine to fill everyone's demand. So if everybody sets up a ProgMod clinic and everybody, hops in and signs up, there's not enough. So then it's, choosing among your favorite children.
Okay, so that's the answer I was looking for.
That's why.
That's why you have to have a cutoff number, and then you have to try to meet that number.
Yes.
There are some confounding factors in between too, Kevin. It's
Mhm.
like, how well do we do the outreach? And I
Mhm.
just posed the real life situation. We have 100 doses. Now, how are we going to get those to phase 1 people that live in our community? And that's going to take some innovation, some public outreach, and then some flexibility among all the staff to set up a clinic whenever we get 20 or 30 at a time, or 40 or 60 at a time. And I'm not sure how many are out there. How many dental practices are in Reading?
And if
I
we,
mean, this is why we're doing this, and I could use a lot of help. I don't know how many we don't permit dental
Well,
offices or any of that stuff.
can I ask,
Yeah,
how
go
do
ahead.
people access this ProgMod? How are they being identified to get into the system to begin with?
Go ahead, Schwang. You can answer
Yes.
that.
So, like the link that I just showed you, it's a private event. That's just for our first responders. But
Right.
if like we want the public access to make appointment online, then we can put it on the public website, and it has it including other clinics in other towns. So that's on that page, then you can find a specific Reading COVID vaccine clinic, and then you can sign from there. The process of registration is the same, but it's just the difference from a private clinic and a public clinic.
So that link
And
can be placed.
I
Okay, go
I
ahead.
went on mass.gov and, the vaccine webpage, and it lists phase 1, 2, and 3 and who can access it. And then it says where to get your vaccine.
Mhm.
And I clicked on Gillette. And so I actually, it gives some information about how to get there and where it is. And then it says schedule an appointment. So I clicked on that and I got the screen that Shuang
Thank
showed
you.
at the beginning. So
Perfect.
because that is a public, as Shuang said, because it's already operational and it's public, you could go right in. So I'm presuming that if Reading has a clinic scheduled, then we would be on that mass.gov website, which is the access to ProgMod to book your appointment.
Yeah,
Yeah.
that's one main way we're anticipating it.
I just shared
Is
with
ProgMod
you
good?
the public site in our chat,
Right.
so
Okay,
yeah, when
thank you.
you click, you can see it.
Is
So if you
ProgMod
open it up-
going to determine if you are in phase 1, 2, or 3,
that was my question.
and then kick you out, or say sorry, come back another day?
Yeah,
Probably.
Yeah.
you know,
Well, I'm gonna go on
that-
tonight and try. We'll find out. I'll tell you how it goes, if I get an appointment or not, because I should definitely be in June.
That's really, you know, I obviously with first responders, it's a very small number. And even with vaccinating doctors and nurses, they have photo IDs. Does, you know,
Yeah.
does the convenience store clerk, how do they prove that they're in phase 2? I don't know. I don't know.
Yes, so that's a concern if we put it on public, we probably need a process to confirm confirm if they are eligible to get the vaccine.
Right.
Then we can let them in. So if we put it in public, it can be a concern. And other people from other town, they can also come because they see it.
Public.
So we may set up a limitation, indicate who is eligible for this event, and we will maybe do some identification on the clinic.
So it also sounds like we're gonna be penalized for not, or letting doses go unused. But are we gonna be penalized for allowing somebody who should have been in phase 3 that just got vaccinated tomorrow?
Yeah.
Is that gonna come up on the system and say, hey,
Yes,
why?
Yes.
we're being warned all the time about that.
So,
Don't cheat.
How do
So-
they know?
so what,
How do
so,
they track that?
They
Well,
get the
by
data.
age, yeah, they get the information that
My hope is, and I will go on the Gillette site and I will try to get myself an appointment. My hope is that it will kick my butt right out of the system and say, sorry, you're not in this phase. Because it should not be pushed down to us to determine that.
Yeah.
That really will drive me crazy if it is.
Well, they may at some point ask for, enter your physician's prescription that says you're at high risk because of underlying illnesses and so forth. You know, people aren't going to want to hear this, and I've been trying to bite my tongue on it, but down where I am living at the present time in Florida, they're way ahead of Massachusetts, and that's a sick thought. But right now, you can go to Publix. I have a Publix 2 miles away from me in one direction and a Publix 2 miles away from me in the other direction. And you can use similar to ProgMod and sign up for a clinic and get your groceries at the same time. It's virtually, and it's not perfect. They run out and you have to check the box that Schwank showed us that says, okay, put me on a waiting list. But you can go to the supermarket or any of our Walgreens and CVS's in this county and get vaccinated. And they're already well into phase 2. I don't think it is. Well, I'm not sure if it is open to the entire general public. You have to be a certain age. But I have friends that are signing up for it and getting it. They're over 65. So by the time it gets to that point, there may be enough different places. When Rick tried to itemize, it's going to either from your physician or from these big events that we're talking about. I think there's going to be a lot more outlets by the time we get it, and we just don't know yet.
Mm-hmm.
You know, my only concerns, like I said, I just don't want us to get penalized, which is going to limit our supply.
Well, that's why we're being very conservative about it and trying to go step by step rather than, you know, full bore.
Yep.
With the all hands on deck model that we wanted to do.
Because this is going to be a long lasting thing. I mean, this is not a, you know, couple weekends of flu clinics. Like I said, this is a long lasting operation. So
right.
There's some deliberate thinking going on. It's you know, being in the planning group, it's been really interesting to hear the great questions and thorough analysis of the existing EDS plan and how to modify, what are the modifications that are needed, reaching out to other communities that have done it to identify best practices and issues that maybe things that didn't go as well. It's a very thoughtful process. So.
No, I'm sure it is on our level. And my issue is with the, you know, some things that the state may be pushing down on us that's no fault of our own. That's that if that starts to happen, I would like to know about it.
Right.
Are
Um,
we
most
keeping
people-
the
Yeah,
second
point, Kevin.
doses?
I'm sorry, go ahead, Jerry.
Go ahead, Jerry.
I was just going to ask, are we keeping the second doses? So when you say 120 doses, that's 60 individuals, or have we been told to do, you know, just first doses only?
First doses only right now. We'll get another supply. They know the date. I think it's February 16th when
Yep.
we have to start giving the second doses.
Carrie, I'm
Can I
going to
s-
direct this
Okay,
question
I'm sorry,
to you
go
only
on.
because, I don't know. It seems a little counterintuitive that we be penalized for not using all the doses if they're trying to reach herd immunity.
They want, well, and again, it goes back to making sure that the doses are actually going into arms and not sitting in refrigerators and not being used. That's the issue.
Yeah, but I mean, but by preventing us from getting it into our other arms, it just,
But there-
I'm
that's
trying to
also-
wrap my head around that.
There are weekly, but I don't know that that's it's not preventing people. It's that it's trying to make sure that people are ordering, as people start thinking about their ordering rhythm, that they're ordering based on what they're actually going to be delivering, not over ordering. So not saying I've got 24,000 people in Reading, I'm going to order 24,000 doses of vaccine. Ordering, we're going to run, you know, a clinic on a Friday. We're going to run a clinic every Friday. Say this is just pretend talk, but say we run a clinic every Friday and we're going to be able to vaccinate 144 people every Friday. Then you set your cadence, you set your ordering, the vaccine is delivered to meet that. That's what they're asking people to do.
So we're going to have to be proactive, like Peter said, and make sure that people know that they can come get it from us when we have maybe more than we're giving out.
That is a challenge. But Mr. Chairman, if it's okay, I don't mind shifting this conversation because we're not done talking about vaccination updates. And
Well-
we can go for what we're talking about here to, go ahead, I'm sorry. sir.
Yeah, no, I think we should probably move on. But is there a time frame? I'm thinking about our next meeting on February 4th. Will we have something from the Incident Command Planning Division that this board could review or comment on? Is that,
Yes.
what's the time frame we're talking about?
The goal is to have something for command to look at in the coming week, and then there'll be some adjustments. So I think probably not unreasonable to say that next meeting, because that's another 10 days. I don't want to speak for Chief Jackson or anybody else in command, though. I'll just say it doesn't seem unreasonable.
Okay, well, if you can just convey that that we would like to be able to review it at the February 4th meeting, if it's available and so forth, because it'll probably answer some of all these questions we've been.
Oh, absolutely.
Yeah. Okay, so we should move on. Well, Peter, command updates or from you or Carrie, any?
Well, you got 3 sets of notes.
We've got the minutes, yeah.
We're really up to snuff with, pushing the notes at you as soon as we get them, and we've been getting them pretty timely.
Yeah.
Any questions about those or anything?
Carrie, did you have a question?
I didn't know if anybody had questions. I was going to speak specifically about a piece of work that we accomplished this week, if there aren't other questions or comments. Okay. So one of the big topics in our discussion on Tuesday was, it's very appropriate to this vaccine conversation. It was about communication, and it was about the communication model, sort of what do we do for pre-event communication? What are we doing for letting people know and trying to address that pent-up demand? And through some active collaboration over the last day and a half, Jane Wellman led a group to do some modifications to the website that include adding, so there's a here's what we know section, and there's here's what we know is kind of like an FAQ. And it goes at all of that and explains, these are the things that we've done. We've done first responder clinics, they've successfully done this. The next phase is this. The state is in charge of all of these pieces. So we had a very I thought it was a pretty good conversation about the communication needs and the, you know, the fact that lots of people are wondering what's happening. And we agreed that the website would be a good place to post regular information, what we know, even though it's fairly small right now. And you know, there's some talk about how do we share this information and make it available so that the board and other town leaders, you know, have the same information and are able to answer the question when somebody says, well, what's the deal with the vaccine? I mean, the short answer is right now we're in phase 1. We're only vaccinating first responders. There is no vaccine available. We'll be, you know, when the state decides that phase 2 is open, we'll be seeing about doing some vaccination for that. And, you know, we have a plan and there will be more information. And we also have the state website. It's COVID everything, right? It's vaccine information that I guess they're updating every Tuesday and Thursday. So we've been directed to, so we have a link to that site and we encourage folks to check that as well. It has information about what phase we're in. It has information about, you know, numbers of vaccinations that have been distributed and the like. And as I said, they've committed to updating twice a week. So we can share at least that.
Where would that would that be in the red banner of COVID?
Yep.
Would that be another section of that website?
So, no, I have it up and I'm not sure that we were finalizing this afternoon. So it's another bullet. And let me just check and make sure it's, yeah. So if I could share my screen, I can show you what it says.
Sure.
And actually I'll show you how to get to it too, just to be really clear. Screen sharing is always a new skill set. Okay, here we go. Sorry. Can people see that?
Yes.
Okay. So, here's our nice mask up Reading. And then there's this new bullet, it's vaccine information, what we know. So if you click on that, then we shift here and it's, sorry, your faces are over it, but it's basic iteration of what the facts are, what we know. The state is in charge of distribution plan. We're currently in phase 1. We've vaccinated our first responders. Here's when we think phase 2 will start. Reading will be offering vaccination clinics, and the goal is right now is for all teachers and, sorry, I can't see it. Maybe somebody else could tell me what it says. Whoops, now I've moved away. There we go. Phase 2 for all teachers and school department staff. And that will be announced through internal communications in here, right? So, I mean, it's a pretty simple piece. Check this page, come back and check the page. Then here's the graphic that shows kind of where we are in the different groups. That'll be updated by the state. And then this link here, COVID-19 vaccine in Mass, is your best source of information for Massachusetts info. So it is simple. Here's the state messaging. But we wanted, I mean, we're mirroring, and there was some judicious conversation of what's it worth repeating that the state has and what do we just want to link to. We want to make sure there was information on the page, but then links so people could follow. So.
Okay, it's great.
Yeah, it was good. I mean, websites are always a work in progress. So, you know, font size and the like. I just want to scroll it up.
Follow, which is nice.
Say again?
it's really easy to follow. I think it'll be helpful for people.
That was the goal, I'm glad you say that. So yeah, there's still some possible discussion, so the banner, we were looking at this banner, trying to figure out if you could increase the font size in there. We're looking at if we could change colors to direct people in different places. Some of that is you can do on the site. Some of it has to be directed by Civic Plus, I think is the vendor that does it. So there was a fair amount of back and forth and thoughtfulness in trying to make it useful. So that was a big part of our work in command on not Monday, but Tuesday. And thanks to Jane Wellman for the work that she did. I'll stop sharing now. And a little discussion about the schools and testing. Figuring out how to roll that out. Lots happening.
Yep.
With communications, testing, and vaccination, there's a lot being asked of folks to manage. It's good work.
Okay, great. That does sound good. I look forward to it. Civic recreation permit issues, I don't think we had any. Paula, you want to update us on this piece of work?
Sure. I've been working with Laura in trying to get, she has put together an Excel spreadsheet with the listings of all the restaurants in the town and who is in charge. And she is going to be going to each of the establishments with the flyer. Peter, do you have that flyer? It's a listing all of the things guidelines that the restaurants need to be following.
Yeah.
She feels that most of them have it, but she's going to be going in and say, just want to make sure, and are you clear on all these guidelines? How can I help? And are you having any issues with staff or restaurant frequenters being compliant? And we're here to help and all that. She has gone to Jane today with the flyer. There seemed to be some question about the branding on the document. She's going back and forth with Jane about whether it's okay to take the state logo off and put the Reading one on. They're hashing that out, but she expects to have the flyers in hand by Monday and to begin distributing them.
So I know that we started this, are thinking about restaurants, but as I read through this, it's sort of generic for really any business establishment that is doing public business. So it might be that, maybe the first wave is the 100 and odd number of restaurants, but maybe we ought to be thinking about beyond that for other types of businesses in town. Because there's nothing here about food particular, it's just more generic, which is great.
Mm-hmm.
Yep. Well, the main emphasis is going to be the, face-to-face hand delivery of the product and, the discussion part.
Yeah.
And don't forget, this was a command sort of idea, and I would call it a mandate. Maybe it wasn't, but yeah, they asked us to do this. They said it might have been a perception, but they thought that was necessary. So we wanted to begin with things that we permit because it's easier for us to manage. But yeah, let's measure. That's why we have Paula working with Laura to make sure we can measure how successful this went in terms of hitting each spot, how much time did it take, and so forth. Yeah, then we can think of the next the box stores or whatever we want, whatever we feel is next. And that should be our call, actually, your call more than mine. What do you think? Where do you think we should go with this? And before command starts telling us what we should be doing, maybe we be self-starting around it.
Yeah. That's good. Nice piece of work.
Mhm.
Thanks.
Okay. Any other comments on that?
I think if I could just go back to that for 1 second, I think we started with restaurants in part because of the whole New Year's Eve
Mm,
restaurant thing.
I see, yeah. Okay. Anything else on COVID? Could there possibly be anything else on COVID?
There's always
Oh, yeah.
something else.
Oh, go ahead.
I
Okay.
was at each of the clinics as well as the Board of Health rep, and I thought they went really well. There are a couple of things that are, we ran into that we didn't expect, like, for example, there were some vials that had 12 doses instead of 10, and other vials that had 9 doses instead of 10.
Oh,
So, which is bizarre, but so we were, and Paul Jackson did a great job organizing it. He had a wait list so that if we had extra vaccine, he was calling first responders and say, can you get down here? We've got a dose for you.
Right.
So that it wasn't going to waste.
that's good.
Mhm.
One of the other little glitches was that they had a system where everybody came into the front of the senior center, went to the stations, got their injection, and then they were supposed to go upstairs to a room where the EMTs were to sit for 15 minutes or 30 minutes if they had an allergy. And the Captain Nelson was checking everybody off as they came in. One guy slipped through the cracks. He just, instead of going upstairs, he exited. Even though the nurses at the stations are telling them, you have to go sit upstairs for 15 minutes. This guy just
Bolted.
hightailed it. So Christine says we have to have somebody at each of the exits when we do the larger clinics. I think that's a good idea.
Yeah.
I mean, it's just, a liability otherwise, or potentially anyway.
Interesting.
Yeah.
Yeah.
If there's any free time, I don't mind chiming in with just 2 things here. The fire department and the emergency medical services that they provide for the town is starting to morph into the primary administrator of the vaccines. And I think that's a good thing. These paramedics are certainly capable of doing it. Nurses are as well, don't get me wrong, but I kind of like the idea that fire is taking really trying to get a little bit more involved, and that's fine with me. We're happy doing contact tracing in the ProgMod piece, and if they can continue helping us on that part. So I say this now, so you're not, wondering how did this happen? The other one, which is a potential, and I actually am concerned about this because, I like to make friends. Let's face it, everybody does in some regard, but we're getting volunteers coming out of the woodwork and we cannot use them. And this discussion has come up, I think, in other venues. Maybe it was with Rick earlier in the week, but we're staying strictly to our thoughts that the master plan of having a medical reserve corps is the best way to manage volunteers. And I'm afraid some folks are going to get, slighted by the fact that, they offered to help and they couldn't find a place, So I would like it to stay positive as much as possible. And I know you folks all out and around the community, need to make it clear we are grateful for the generosity and the charity that's being, shown to us. But gosh, if we don't have a system in place to help manage the volunteers, it becomes more of a challenge than more of a hindrance than a help.
Carrie?
Peter, isn't it true that if people are interested in volunteering in general, they could go to Mass Response and register to be a volunteer and then be credentialed and so forth, and
Have to
be
be
assigned,
That's-
to a medical reserve corps unit. Is that correct?
Yep,
Yeah.
that's another way
that's-
through it, absolutely.
That's
I
one
think they
way.
want you to do that, right? So you have to go through Corey and you select which ones you want to be part of
Hmm.
and sign you.
Yeah, they review all medical credentials. They run a query and they do the sexual offender check. And it's, so there's some nice safeguards in that.
That's mass response, right?
Correct.
I have nothing else on COVID for tonight anyway.
So at our next meeting on February 4th, the things that I've listed, I've talked to Kevin about updating us. He goes to the Coalition Advisory Board meetings. There'll be one, I think, next week, and he'll update us on that. We'll have all the COVID items with a particular emphasis on the vaccination plan and where that's going. It's the first Thursday of the month, so we'll have the Health Division staff report will be due
Yes.
then. And I thought we also might have a discussion. We said we were going to revisit the whole idea of having a consultant come in to do an internal assessment. And we kind of tabled that last December when Peter came on board. And I just want to have another discussion and see where that is and what thoughts are about going forward. So we'll plan on that. And if anybody else has any other agenda items, please email me and we'll get them on as well. Okay. Anything else? I make a motion to adjourn.
Second.
Okay, roll call. Carrie,
Yes.
Paula? Rick, aye. Thanks, everybody.
Everybody.
Night.
Meeting.
Stay
Thanks, folks.
safe.
Okay,
Thank
okay.
you.
Bye.
Good night.
Thank you, Shuang. That was great.
Yes, very helpful.
Thank you.
Nice job,
thank you.
Shuang.
You.
Good night, everyone.
Night.
Thanks.
Good
Good
night.
night.
Night, Jackie.